Before we get started in this episode, a quick announcement. As you know, I'm very passionate about acceptance and commitment therapy, and I also run a busy practice in Canberra. We're currently looking for psychologists who are registered in Australia to join our team, who are also passionate about learning about ACT. We provide supervision on a group and individual basis and training around ACT. So if this is you, if you're interested, please express your interest at strategicpsychology.com.au/careers. Look forward to hearing from you. And now back to this episode.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking. Yeah, better thinking. Time to tune in. Let's go.
Welcome back to Better Thinking. My name's Nesh Nikolic, and my guest today is Dr Micah Goldwater, who is here to talk about psychology of pseudoscience and conspiracy theories. Dr Goldwater received his BA in Linguistics from the University of Rochester in 2003, completed his PhD in psychology at the University of Texas at Austin in 2009, and then held a postdoctoral fellowship at Northwestern University until joining the University of Sydney in 2013. Dr. Goldwater's research investigates the nature, acquisition, and use of knowledge. His work focuses on how children and adults can look past superficial to recognize when disparate situations, problems, or ideas share deep structural commonalities. He examines both basic processes of cognition and development, their underlying neural mechanisms, and develops applications to improve education and public health. To achieve these broad research goals, Dr. Goldwater investigates a number of interrelated topics such as understanding the psychology of pseudoscience and conspiracy theories. Fascinating conversation today. Dr. Goldwater's got so much knowledge in this and really uses some fantastic examples that make it very interesting to be able to observe yourself, hopefully, and notice your own biases that creep into the way that you think and understand this world. Enjoy. Micah, a big thank you for coming onto the show today.
Thank you. Happy to be here.
Look, I'm really excited for this topic, probably because I can see aspects of myself enjoying, conspiracy theories and seeing how biases come about, seeing, pseudoscience examples occurring in people's conversation and the like. So really eager to get stuck into this and find out more about, how this plays out in life. How does it work? What are the factors that have that are in play that have shown, how funny the world can be at times. And, that I think that's relevant in, if you're human. So, looking forward to finding out and learning more from you.
Oh, yeah. Very happy to have this conversation. And I'm sure it'll be very insightful to hear your perspective. And how that
goes. Maybe we can start from where we maybe touched from just before we started recording, about how sort of this space of conspiracy has kind of exploded a little bit in the recent years with COVID and other sort of factors coming up, which has almost been a nice germinating ground for so many unknowns and people being able to put things together. And obviously there's probably been so much pseudoscience and conspiracy all enmeshed together. So I'd love to hear your thoughts, your views.
Yeah, totally. So there's a handful of kind of interrelated topics, especially from the kind of psychology side, where we're kind of looking at similar factors, where a lot of it all kind of comes down to things like, research into sort of believing things that don't seem to be grounded in what a scientist would think of as evidence, right? But of course, not necessarily faith-based things where, there's long, religious traditions and things like that, but more, sort of events and things that are sort of happening in the world now, right? Sort of, and what are the factors that lead people to believe these kinds of things? And and so sometimes this research focuses on, individual events that aren't quite accurate, or other times it's like, more general kinds of beliefs like this type of medicine is good for you, or, or vaccines cause harm, these kinds of things. Or sometimes it's much sort of more elaborate conspiracy theories, like, QAnon, where there's a deep state against Trump, and there's, people, these guys are feeding this information to, his loyal followers to help solve this puzzle, right? So all this kind of stuff is sort of interrelated in the research and psychology side. And so this research was always around, not always around, but, in the sort of contemporary history of experimental psychology, there was sort of people looking at, things like sort of false memories or misinterpretations of past events, or things like just believing lies in the media. But then around after the election of Trump, where so many things were so blatantly, he was just sort of lying it seemed to be all the time. People were believing it. and that with COVID and all the kind of conspiracy theories that emerged around COVID, around, how it's actually a bioweapon from China or whatever else, this sort of, has really sort of exploded, where the number of papers on some of these topics since 2019, I've been working on this kind of review paper of all this stuff, and we were looking at just the number of things that come up from research on like debunking or things like that, right? So research that sort of attempt to debunk things to see whether or not it's effective or what makes it effective or not effective. And we saw that basically the papers from the beginning of the field up through 2019 is basically as many as from 2019 to now, right? So the amount, so there's been a huge sort of, the amount of like papers published per year on this has really increased. Right. And so for all, and all these types of societal reasons where it's sudden, because, sometimes in the past people had conspiracy theories, right? It was things like, oh, they faked the moon landing, right? Or, something like that. And there wasn't, and we would kind of go, oh, that's kind of cute. Haha, what a kind, or that's sort of it's sort of this funny kind of thing to think about, but it's not, there didn't appear to be the same type, no one was storming the Capitol because they faked the moon landing, right? It sort of exists in this other space. Or no one was protesting public health interventions when there's a pandemic because, of a flat earth theory, right?
It's interesting how the environment is such a huge factor in terms of whether there's uncertainty going on, whether there's people in who are desperate, challenging times. I mean, I just recalling from my own experience, I remember watching a documentary on the moon landing that was, effectively saying that it never happened.
Right.
And I was so convinced by the end of it. It was so compelling. Like, they got all these experts on there who, they say that, they're connected to NASA and, and obviously, first of all, from that perspective, I can't go out and corroborate whether they are or not. They can just say that this is who they are. At the first level, there's an assumption that what's being said is even valid, right? And if it is valid, and then you hear these people saying these things, well, then you're going, well, that seeds, some doubt and questions the whole validity of it. And by the time you go through 90 minutes of this, you're like, I don't know who to believe. Like, did we actually ever land? If we did, how come we can't do it anymore? And so you go into this kind of very strange place, and that's when things are going well. Let alone when there's a bit of crazy going on, and you got Trump saying these catchy 3 words or whatever it is that I think are very sticky. He has some innate way of saying little phrases, or maybe just says so many that once one sticks and the media love it, they just fuel it, and then we all hear it, and it becomes repetitive, and therefore, I don't know, it gets more stickiness, it gets more power, more momentum.
Yeah, no, 100% right. He is a sort of unique figure in his ability to kind of captivate an audience and to be, to rile up these types of feelings where, like, it's one of these things where, because of his training in TV and all these other things where, and so on the one hand, in the traditional political sense, right, he's kind of this, he never held office. He wasn't in the army. He didn't do any of these things, right? But he was this, you watch him at these rallies, right? And he clearly has a kind of ability to sort of just have all these people just believing whatever is, he's saying in a way that that you couldn't just replicate. It's not like you look at that and go, anyone could do that, right? But sorry. So I think it might be worth building back up to there. But one of the things you were saying about the compelling nature of these conspiracy theories, right? So it's worth talking about all the sort of the psychological factors that lead to a lot of this stuff, right? One area. So I sort of break things down into a kind of what's the kind of cognitive aspects of this, and what are the kind of social and emotional aspects of this? Mm-hmm. Because I think when it comes to this whole area of misinformation and pseudoscience and conspiracy theories, they're both aspects of psychology are quite important. So from a cognitive side, right, we look at the psychology of the cognition of explanation. So how do people explain things in the world, and how do people sort of understand explanations? And there's a lot of work on this where people basically can get extremely confident in pretty bad explanations or pretty shallow explanations. And we all sort of do this. And not only that, we don't really sort of realize when we don't really understand things. We tend to think about the world, and we sort of go, do I understand this? And we often just think yes until you're prodded. So some of the examples of this were very, completely non-conscious, this was sort of disconnected from any kind of political or whatever. It was things like asking people, hey, do you understand how a toilet works? People say, yes. And then you say, explain to me how a toilet works. And they go, well, I hit the button and then it flushes. And then they sort of realize, I actually don't understand how this works, right? And so, however, because we sort of successfully interact with toilets all the time, right? We know how to get them to do their function. It gives us a sense that we understand them, right? And they did this with like automobiles, all these sort of common artifacts that we interact with all the time, that we use to achieve our goals. And because of that, we sort of build up this sense that we actually, that we actually understand, that we sort of understand them and can explain them. And so that's sort of part of it. So that's called the illusion of explanatory depth, where we sort of think that we have deeper, until you specifically interrogate it, you sort of walk around the world just kind of going, okay, yeah, I get how this works, right? So another part of that same phenomenon is that we also get more confident in our understanding when someone else in our social group understands something, right? So let's say, for example, something, so in the toilet case or in the car case, we know someone understands how those things work, because how else could you make them, right? We sort of know that a plumber gets it, right? And like, I could just ask the plumber, right? Or even I can just Google it, right? So there's all this evidence that when you're aware of how you can get the information, that also increases your confidence of your current understanding, even though you don't actually currently understand it. Right. Mm-hmm. And so, these are these kind of metacognitive illusions where where we are overconfident in our understanding. And so that's one aspect of it. Right. And so also that means, and on the flip side, it also often means when people are sort of giving you a kind of more shallow, not a super deep explanation, but it kind of fits together well, people are also happily they look at that and go, oh yeah, that makes sense. That explains it, right? But part of it is that we also, despite not necessarily having the most sophisticated explanation for things, we really want explanations for things all the time, right? We're really driven for explanations, especially because they help us, because the idea sort of is, well, if we want to be able to act on the world and to achieve our goals, explaining things is what will sort of get us to reliably act on the world and achieve our goals. And so we're sort of motivated to do that. In the social realm, if someone doesn't, respond to you, if you text someone, they don't text you back, you start coming up with all these explanations that are kind of like conspiracy theories. You're like, why aren't they texting me back? It just turned out their phone was off, or something, right? But you're like, this person mad at me, or whatever, right? That's sort of that's sort of one factor. Another factor is people very happily blend different kinds of explanations together. So some people are very surprised. Some people think, well, if you're kind of a science person, some people will go, oh, I believe in science. People say like, I get the vaccine, I endorse, I support climate change mitigation policies, things like that. And their kind of assumption is like, you're a sciencey person. You will sort of have some sort of internal filter where you're constantly making sure like what ideas are science and what ideas aren't science, and you're going to kind of put the non-science over here and the science over here. But actually, that internal filter doesn't really exist, and people blend non-scientific and scientific ideas all the time, partially because often the scientific ideas were not unless it's like your area of expertise, like you're a microbiologist and this is like your area, right? In that area, you have a really deep understanding. Outside of like your deep expertise in something, right? Our understanding is sometimes quite shallow, right? So for example, in COVID, we're like, or how do vaccines work? I'm like, oh, well, you have a small amount of the virus that like helps build up your antibodies. And that's my entire understanding, right? Like that sentence is my whole thing, right?
But it is interesting because it's almost like we yearn for certainty.
Yeah.
And so when there is uncertainty, we fill the gap with a story of certainty. So it's like, I feel comfortable, I feel at ease if I know, and I feel uncomfortable, I need to scratch that itch if I don't know. And rather than going out and, spending time actually doing thorough research and checking that and so on and so forth, and maybe even enrolling in a course. I will actually just quickly do a Google search, grab the first one at best, and plug that in. Or I'll just ask a friend and they'll tell me their, heuristic shortcutted version, and I'll go, yeah, that makes sense. We'll run with that.
100%. Yeah. So sometimes I talk about some of this uncertainty stuff as sometimes in the like the kind of, so there's this thing called intolerance of uncertainty, right? Where people vary in how aversive they find the experience of being uncertain, right? So some people can kind of go around going, I'm uncertain about that. That's fine. And they kind of go about their business. And other people are like, this uncertainty is like really hurting me, right? And so this research is that actually has been used. So one thing I think is interesting that I might think about as an area of research is that people sort of looked at that in separate areas. So on the one hand, that's actually used a lot in clinical work as a transdiagnostic tool. I've seen some work so intolerance of uncertainty as a scale is used, and I've seen how it predicts depression and anxiety and all these other kind of, and so and I've seen some work focusing on intolerance of uncertainty as a way to sort of help an underlying factor among multiple types of psychopathological symptoms. But on the other hand, people have also looked at this, but kind of independently in this conspiracy theory domain, where this where this sort of intolerance of uncertainty leads, exactly as you said, to sort of fill in these gaps in their the sort of just I'm going to create a coherence to this explanation, right? And that's actually, and that you see that, that comes up a lot with the persistence of misinformation after it's corrected, right? So people have shown this experimentally, where you just sort of, you give someone an explanation for here's some event, it's something like, there was a fire at this plant. It's like a made up news story. Someone, it was arson, something like this. And then they go, actually, it turns out it wasn't arson. But then they don't provide another explanation for what happened. There's just no explanation now. And the arson explanation kind of persists in people's mind because there wasn't this sort of, and they sort of show that even though you remember that it's not arson, they still make all these other inferences. They still sort of reason about the situation as if it were, because they can't just sort of have a hole in the explanation, right? And people have related this to, for example, that original vaccine an autism paper. So the original paper that was retracted, right, that made a link between vaccine and autism. One of the reasons why it persists is, even though there's no evidence that, right, it's very clear that rates of autism is not any higher in vaccinated versus unvaccinated people. So there's no, there's nothing there, but we don't have a good explanation for what causes autism, right? We don't actually, the fact that we can't say, here's the real explanation, right? And we just have to point to the statistical evidence, right? The fact that we don't necessarily have a really strong, and there certainly are theories, researchers in autism certainly have different theories about how it causes, but it's not like we can just say, hey, here's how autism is called. And because of that, that sort of lets that sort of that other idea linger, right? Because we haven't adequately replaced it. And that also then leads to another aspect of pseudoscience, where what's some of the things with how people just sort of blend exactly what you're saying, where you can sort of put all these pieces together, and each individual piece might be reasonable, but people have sort of put them together into this explanation to feel a coherent whole that isn't really there. So, for example, in the vaccine autism case, there's this example where they go, okay, well, we know neurotransmitters are the microbiome in the gut helps to generate neurotransmitters, and that is, that appears to be a true thing, right? And then they said to saying, well, in the vaccines, they have all this like impurities and toxins in the vaccine that isn't just it's the manufacturer. It's not just what's in the vaccine, but it's all the other stuff that's like part of the commercial product. It sort of messes with the infant's gut biome. And then the infant's gut biome can't produce the neurotransmitters properly. And then that leads to these like brain issues that leads to autism, right? And so you say all that and you go, that sounds pretty sciencey, right? And so one of the things that distinguishes, say, pseudoscience from something like, just sort of religious explanations of things like that, is that there is this attempt of bringing all these scientific concepts into it, right?
It's so complicated because of that, and then on the other side, we might look at things that are, I think, fairly well documented that are theories, but they're not actually proven. Like there are chemical imbalances in the brain that cause depression. It's like that's been marketed so strongly by the people who are selling these products as a kind of like a theory or a proposition, but it's marketed in a way that kind of says, no, it's not really the theory. It's actually the explanation. So in the same vein, in the both medical, one is kind of saying this is kind of preposterous and it should be, thrown out. The other one's like, gosh, this doesn't have any weight. Yet a lot of people still carry it around, and very intelligent. I mean, doctors and psychiatrists who are unbelievably well trained, much more intelligent than I, might still be saying this, even today, rather than saying we don't actually know why, but we can still see some efficacious, properties from this. But we tend to just give a story with it to maybe, I don't know, improve people's use, that they will actually follow the regime or not. Who knows why, but we do it.
Yeah, you're 100% right. And what something you were saying earlier, right, is that because of, exactly right, because ultimately, right, when it's not, it's sort of trust in other people all the time, right? Yeah. So you always have, so as I was saying, unless it's like you're the scientist and it's your research paper, it's not even someone else's research paper. It's like I've literally done this experiment, right? It was me doing it. If it's not that case, then like every other situation, we're just relying on expert testimony, right? Yeah. And I go to a conference, I don't have time. I sort of assume, in that case, I assume, well, hopefully someone will attempt to replicate this study. And so someone, the assumption is if this is wrong, this will eventually come to light. And I have sort of faith in the scientific method to sort of do that. But at the same time, I'm still basically just walking around believing what people are saying and that they're not, making this all up. Right. So, but you're totally right. And it brings the challenge of the influence of pharmaceutical companies. Well, I think one of the things we're sort of talking about here, right, is that a lot of the anti-vax people are very skeptical of pharmaceutical companies, and that is good, right? So pharmaceutical companies, there is a large history of pharmaceutical companies really biasing research findings, right? That happened. Now I'm sorry, I'm suddenly just blanking on his name. There's this great researcher in the University of Adelaide who's a child psychiatrist and has written a lot on the bias, all the ways that pharmaceutical companies have kind of biased, like antidepressant research, for example. And things like where they've really downplayed negative side effects in certain cases, and have had things like he sort of pointed out, there are these cases where the marketing companies of the pharmaceutical companies have actually written these papers, but the names are on the authors of the papers are these are officially independent scientists, right? So, and so in this, however, right? So one of the challenges from the kind of scientific community who don't want this industry, this industry influence, is how do we communicate that the industry does bias findings in lots of ways, but the vaccines are still safe and we should use them, right? Because it's actually quite reasonable. I am actually quite sympathetic to, right? Because exactly what you're saying, where people are presenting that, and I see this all the time, where people are saying, actually, we don't have very good evidence that depression is caused from these brain chemical imbalances, right? I mean, it seems like something like that has to be true, and because the brain is like, something has to be going on that's something like a brain state, right? But that doesn't mean it's necessarily the most useful way to think about it, right? So even if that's sort of true, it doesn't mean all we have to do is have this one pill that changes that brain chemistry, and that's all you're gonna do, right? Right. And so that's actually, you're totally right, that given that we all are just have to trust people in doing any of this stuff, it is quite challenging to be like, well, what's the difference? Like, why should I trust the pharma? Why should I take this, drug and not this other drug, or whatever, right? And of course, in the vaccine case, right, one of the, at least in COVID's examples, right, when it's all out in the world, right, you can just go and measure and see what happened to people in the world. It's no longer at the laboratory or the pharmaceutical industry, right? So you could do this other kind of research that's out there, that you can go like, okay, if this was killing everybody or something, or, we would have, independent researchers would sort of find that, right?
It's really
anyway,
that's complicated, because usually in a one-on-one relationship with someone, if trust is broken, people will disconnect. But in these scenarios, what we're talking about is you cannot disconnect from these relationships, because they're kind of ongoing. In many ways, a lot of people's trust has been at least questioned with the pharmaceuticals from time to time, depending on what the scenario is. And at the same time, we go and reach for it because we see the great evidence and value that has been brought by, medicine as well. So there's this ongoing relationship. And even when there are, significant trusts that are broken, we still have to live with that. It's kind of like a relationship you can't divorce from. And so how we think about this, or the volume of how many times something's broken, or even might be even how large the breaking is, or how much it just relates to you personally. I'm sure that someone who has a child who was who has autism, particularly of a severe range, if they believed that it was related to the MMR vaccine, it would be extremely hard to ever be able to pull that apart. But the further you get away from it, because you don't have that personal connection with it, it's probably easier to pull away from it, or see both sides rather than getting stuck on one. But it's complicated because it's an ongoing relationship. If just talking about the pharmaceutical part, you're in a marriage with pharmaceuticals for a life, right?
Right. Yeah. Right. Because are you really going to say that's it? I'm never taking an ibuprofen again, right? You're
If I have a car accident, don't take me to the hospital,
Right. Yeah. No, 100%. And so it is right. It is this very complicated situation, but so hopefully, right? Ideally, you can. So one of the things that is helpful is trusting your primary care physician, right? So there is research sort of showing that trusting your primary care physician and trusting that your doctor would listen to your concerns about a vaccine is actually predictive of being willing to accept the vaccine, right? Yeah. So one of the issues is, how do we make sure that the relationships between doctors and patients or clients, isn't broken, right? Because when you have that strong, of course, there's lots of, as we said, every individual doctor is fallible. They could be wrong about all kinds of things. As you were saying, they might just sort of come in and say, hey, I've learned that, this is what causes depression or whatever, right? And they can certainly get influenced by the pharmaceutical industry. And there's lots of evidence of that. But at the same time, having a trusting relationship with the doctor is better than not, right? And so that seems to be a really important avenue. So people often talk about, well, how do we counter some of these? How do we counter some of these things, at least in the health space? One of the ways to sort of do it is to make sure that we have a healthcare system that fosters trusting relationships, because I know, at least in America, that has totally gone away, right? So the way the sort of pricing and billing and insurance works, the way that the way doctors can't do anything without potentially the insurance won't cover it if you don't do it this way or that way. There are all these sort of restrictions that ended up leading to the doctors not even really wanting to sort of build a relationship with their patients because of all these financial structures, right? And so of course, you could still do it in some cases, but if there are these real barriers, right? And so I think that is an important point of connection, right? And so, because one of the things that I guess how this relates to some of these things, right, is that when you do lose this institutional trust, so that's also one of the things that leads to these conspiracy sort of endorsements, right? So a completely lack of trust, and sometimes that lack of trust, and also relating to your uncertainty aspect, there's also when you feel like you've lost a lot of control in your life. So the combination of a kind of lack of trust and a loss of control, because the thing around the uncertainty, right? The uncertainty is often related to a sort of a lack of agency or feeling of agency in your life, right? When there's all this uncertainty and you don't know, and there's nothing that feels like you can do about it, people then have this even greater need for these sort of stories, right? And there's been some studies, for example, just showing people kind of random patterns and inducing a lack of a sense of agency in them, where and then they're more likely to see patterns in the randomness than than if they sort of haven't been induced to have this lack of a sense of agency, right? And that was just a little perceptual kind of experimental trick, but the sort of principle we're trying to sort of look at, right? And then if you look at the certain types of narratives that people then get into, something like QAnon type of thing, it sort of pits you as the kind of hero in this story, right? So you're sort of both, so the people, for example, in the QAnon case, they're both the kind of victims of this kind of deep state, but also they're the heroes of being able to sort of help Q fight back against the deep state and help their guy Trump or something like that, right? So there are these narratives that are built so you're totally right. So this combination of when you sort of feel like you've lost agency in your life, you lost trust, and you then, one way to feel that sense of certainty back is via these stories, especially where you have that role. So that's a big, part of that sort of, a lot of those are the kind of social emotional aspect of it. Oh, and then of course, in addition to that is the social identity aspect of that as well, right? Where
before you jump into that, it's really interesting as you're talking. I'm sort of thinking about part of my heritage, being Serbian. And look, this will probably be a biased view, because obviously I don't want to characterize the whole of Serbia or other countries as well. But it almost seems to me like when I go visit Serbia, where my family's from, I do hear a lot of pseudoscience floating around that is adopted very easily, and it ranges very, very broadly from, if you go to certain part of the hills and in nature, there are these energy areas that are healing. A lot of it is healing based. If you drink from these springs, the springs have got these minerals that come out, and the minerals are perfectly balanced because they come from nature. And so and so, who's famous was there, and this other person went there as well, and so and so drank it, and their cancer went away. There's so many of those prevalent, and I don't know whether that's a bias thing because I've heard lots of it, and we don't tend to talk that way in Australia. But
Sure.
I'm wondering where there's a education thing going on. Certainly not suggesting that Serbians are less educated, but maybe the conditions of a country. They live in more desperate conditions, harder conditions. Unemployment is very high. There's lots of social problems. Their medical fraternity is absolutely, broken. So many systemically, it's broken. There's so much corruption out there. It's and it's a war-torn country that's had so many leaders, and all horrors have occurred. I'm wondering if that plays into it versus you just don't hear it at the same volume here in Australia. Well, I certainly haven't felt that way.
Oh, 100%. So, right. So actually, the focus on healing, right, you see this a lot. So when I was talking about, for example, the blending of scientific and non-scientific things into people's explanations, right? You see that a lot in the kind of alternative medicine sort of space, right? And so you're
and that's probably where I'm unfairly characterizing Serbian, so I better pull back there in case of any Serbian listeners. But you do hear a lot of whether it's European or even the moment you walk into the Australian culture and start looking at that space, the alternative medicines, it just blows up. It goes wild.
I'm sorry. I'll be right back for a second. Sorry.
Yeah, no problems. I think what is interesting is where there maybe is a lack of how should I explain this? A lack of science, where there hasn't been as much rigor in the scientific method, or people replicating research. We start to maybe open up to stories or these pseudoscience possibilities occurring, where we blend the ideas and they start to sound kind of reasonable. And there's a lot of anecdotal evidence that starts to creep into all of these areas, and I think that anecdotal evidence becomes very compelling because if we've experienced it ourselves, we believe it'll apply to everyone else. And maybe that's also where the placebo effect kicks in, is we know that placebo effect is alive and well, and the fact that medicine tries to often use placebo as a control, and if placebo is used as a control in medicine, we can at least get an understanding of whether there's a increased effect on something to promote whether it's valuable or not. And I think in the alternative world, with the lack of research, with the lack of other researchers going out and replicating, we start to find that space of anecdotal evidence saying it must work. So if I take a sugar pill, we know it works, and I think we know that a small blue pill works than just a regular white sized pill. And so it's interesting to kind of see how, in particular, the alternative medicine world is I think prone to conspiracy theories. Would you agree with some of that there's a lot in that space?
Yes. No, totally right. So there's a few different, there's definitely a bunch of sort of related issues in there, right? So one of the things that,
and one of the things that
sorry, but
no, you're right.
But that, so one of the issues is that, right, so we have these there's a handful of related sort of biases, right? So one of the things you sort of mentioned, right, there is this strong bias of naturalness being really good, right? There's a sort of notion that naturalness, that Mother Earth, right, we're going to sort of heal ourselves. People have always had the ability to heal themselves. People have always had the ability to, sort of heal themselves. We need to boost our natural immunity, right? Modern society is what ails us, is the real, problem, all these sort of modern toxins. And if we go back to our kind of natural state, then we will be healthier and happier, and these types of things, right? So there's that.
And a lot of that is valid. We know that obviously with history, we're living longer and longer and better. At the same time, if I were to go out and take someone who, 500 years ago, and I splash chemicals all over them, they wouldn't be better off by having all these chemicals splashed on them. We've progressed far ahead, that our lifespans and quality of life and actual health in old age has improved significantly. But it's actually still true that don't splash chemicals on your body. Period. Right. That makes sense, but it can get to 100%. The absurd level, can't it?
Yeah, right, 100%, because, just like, for example, right, pesticide, right, you shouldn't just drink a pesticide, right? There's all kinds of things, but also there's, when you think about the naturalness, but also diseases is natural, cancer, there are all these horrible things, right? I mean, if you look at nature, right? You watch a nature documentary. Look, that crocodile is just eating that, whatever, right? Like, that's natural. I don't want to get eaten by a crocodile, right? So, so it doesn't take that much to necessarily think like, well, there's really horrible things that can happen naturally and artificially and vice versa, right? There's really beautiful things that are all natural and, right? So it's one of those things where and so that's one of the reasons we call it sort of a bias, is that rather than taking each case as it comes, I mean, like, is this specific natural thing good? Is this specific artificial thing good or bad? Right? There's a kind of an assumption, oh, well, natural is just a kind of good thing overall, and artificial is like a bad thing overall, right? And so, and so that's often in the backdrop that sort of promotes these. Now, of course, any particular any particular explanation that someone may offer, these springs are particularly healing or something like that, there might be, these are the minerals that are particularly healing, right? It gets much more specific in that case beyond a kind of, well, it's natural and therefore do it, right? But often you see that this kind of naturalness bias is an underlying motivator to a lot of those kinds of, a lot of those particular instances. And we're talking about these cultural differences, right? Now, it's
just quickly jump in before you go.
Sure.
That really does link in with that cognition of explanation, because the moment we factor that in, like, we might go and say iron is good for you. It's like, sure, but it depends on the context. And so if we find iron in this stream, and you drink it, that will probably add iron into your system. That makes sense. But we don't even know how iron works. I mean, maybe doctors certainly do. I'm not sure. Maybe you do. But my explanation is, I don't know. You drink iron, it goes into your gut, you absorb it, and it your goes into your blood, and blood uses iron to take oxygen around.
Right.
So what does that mean? Like it's
No.
so basic. You have no capacity, and it might not actually even work that way. It might work in a completely different principles and so on. But the cognition or explanation, just comes in and says, hey, this is how it works.
100%. I mean, and I have some colleagues who've done some work on the way nutrition is described, and in the past, and I still sometimes comment, you just sort of tell people what things are good at. They don't even offer any kind of explanation. So, for example, bananas are good because they have potassium. What does potassium do? I have no idea. No one knows what potassium does. It's not, I mean, obviously some people know what potassium do, but the number of people who could tell you bananas have potassium and that's good, I think it's probably, millions times more than the number of people who could actually have any kind of even the level of the explanation, like, well, a vaccine, like a vaccine increases your antibodies with a small amount of the virus. Like, people don't even have that level of explanation for things like potassium. Right.
And then you mix it in when you have kids, you go, bananas and the potassium, makes your kids constipated. Like,
right. Yeah. Right. Right. And you're just like, okay. Right. Yeah. So, they've actually done some, this is Derek Powell of Arizona State University has done some work on this where, even offering just like a little bit of, so even though we're sort of saying on the one hand, our explanation, we kind of are happy with somewhat shallow explanations, even giving just that little bit can actually be persuasive. And you're sort of showing that offering some of that for nutrition, like potassium, offering just these little common sense explanations are actually more convincing to get people to think, oh, maybe we should eat more fruits and vegetables.
It's got potassium.
Yeah.
Rather than a banana.
Rather than just saying rather than just being like, here are the things that are, So, I mean, so 100%. I mean, and also, we look at a couple of these biases as well, where, and talk about the natural medicine sort of space, right? Where most things you get healed from, right? Just generally, right? It's only one time where you're not going to heal from something, right? So, most of the time, right? I mean, I guess things are chronic. Sorry, I mean, right? You can live with things you don't heal from.
I get it.
Yeah. Sorry, right. Yeah. Sorry. Right. But, so for example, if you think, like herbal, let's say you take, so people were like, okay, let's say you have a cold, you take a herbal pill, and then you feel better, right? Now, you don't necessarily think, would I have felt better anyway?
Yeah.
Right? You attribute it to the action that you've taken, right? Because part of what the sort of similar bias to like the, I flush the toilet and therefore I understand how it works, right? We kind of attribute, we sort of attribute causal power to the actions that we take, right? And so if you took the pill, you go, well, that's the thing that did it. You don't think, well, actually, I have a cold, and if I don't do anything 2 days later, I'm probably, going to bed. So that's another one of these, so there's really a host of these sorts of, things like that, where they all kind of lead in support of it. And it makes total sense, right? Because, if you also think about something like, talking about placebo-controlled trials and randomized trials and things like that, those are very like new developments, right? We've been having, medicine. We've been like, there have been people practicing medicine on Earth for thousands of years, right? And the idea of having like a placebo-controlled randomized trial, right, is like not very old in comparison, right? And also we've so using non-method, not using those methods, people over time have developed things that seem to work pretty well, right? Of course, now we would say if any of those things really did work, then we could just do a randomized controlled trial on it and we would show such a thing, right? But it certainly makes sense that that's not our kind of default way of thinking, right? If it was our default way of thinking, there wouldn't have to have been a scientific revolution, and all these other types of things.
We're such pattern recognition beings, is that we therefore walk around and do that classic thing that was kind of forced down our throats of correlation doesn't equal causation.
Yeah. Right.
Which is such an important thing to understand and learn. And at the same time, in the absence of a capacity to do, RCTs, it made sense that, Aboriginals walked on, through the Australian bush, and when one had a cut or a sore or a boil or something, they put a certain herb on that, and then, after some time, they recognize whether one helps or not, and there's a bit of pattern recognition, and then that's passed on to the next. And so all of a sudden, the RCT, not that it will be that controlled, but the RCT might go over 10,000 years or something like that. Then 100%. Eventually you've got, a fairly reasonable palette of items you can go to in the bush and say, this is useful for this is useful for that. And at some level, it's probably got some validity, and, hence why we go and try and study some ancient places and say, what do you guys use and what's in that? And maybe we can try and put the microscope on that from a scientific perspective and see where's the merit in this.
Oh, 100%. Right. Yeah. Because if you're sort of testing it out, what we might call sort of informally, even though it might have been quite, in the sense of from the modern guys, right? If you do that for long enough, as you're saying, you're going to have enough observations that the chances are exactly right that you really definitely have got onto something for sure. Right. And sorry, I just wanted to bring back, because you also had that question when you were talking about Serbia about about education as the issue.
Yes.
And I wanted to say that when we're talking about some of this work on education is where some of this work came about, where people were noticing that people would happily kind of blend scientific and not scientific things together. So there's this thing called explanatory coexistence, where in people's explanations, they're happy to have sort of science and sort of something that's not science. And so some of the work that first sort of looked at this by Christine Laguerre, she went during her PhD, she went to South Africa and this was in the mid 2000s. And it was a bit after the sort of peak of the AIDS crisis. And in the bush there, right, at some point, education came through. And this sort of Western education came through, and there was this idea that before HIV was transmitted via witchcraft, right? And then there was this education program. It's through the blood, it's sexually transmitted. You have to, if you wear a condom, you can prevent this from happening, things like that. And then what Christine did is she talked to a lot of people and sort of got them to sort of explain different scenarios of people getting infected with HIV, and what she saw was that the education didn't replace the previous knowledge, that they kind of blended it. And so there'd be things like, I got HIV from sleeping with an infected woman, but I was only attracted to her because of witchcraft, right? And so like the witchcraft was still playing a role. It just wasn't like at the moment of transmission, right? And so the two different ideas kind of got blended together. Now it's one of those things where we look at that and go, oh well, maybe that's these bush people in Africa or something like this. But then she started pointing out that this is actually the normal. This is the default all over the world. And one of these examples that I think about is put your coat on or you'll get sick when it's cold outside, right? If you go outside in the snow, you're going to get sick, right? That's not how you get. And I sort of realized I had kind of blended these things together where I was like, oh, well, if you're cold, you're probably more susceptible to getting sick, even though it is actually the virus that gets you sick. And then I was looking into that and I was like, wait, there's actually no evidence that that's really the case, right? So I did find one paper in 2015 in mice where colder mice had mice that were colder had virus replicating slightly faster. But that's like this one paper that sort of found that, and that's certainly not the basis of anyone's idea that being cold gets you sick, right? And I had totally just right. I had totally just taken some old, wives' tale type of thing and just blended in with my understanding of viral transmission. Right?
It's fascinating. I actually laugh about that quite a lot, with my parents, because that's a classic one. It's like, don't go outside, it's cold. you'll
Yeah.
catch a cold, or drafts are a big one. You're not allowed to have a draft in the house,
Yeah.
or having wet hair. If you've got wet hair and you go outside, that it's got nothing to do with the pathology of an actual virus that you touched and licked and so on. But at the same time, even though I laugh at that, I was observing myself, speaking with Dr. Christopher Hunt on previous podcast, looking at gambling, and I could just observe myself trying to put these explanatory, coexisting stories together, trying to get my head around, what are the features and factors that come together for people who are having difficulties with problem gambling. And it was just fascinating to see myself doing exactly what you are describing here. Is you use a little bit of evidence, and then you kind of put your own narrative around that. And some of it, is bound in more solid evidence, and the other part is just this other explanation. It's kind of like it's difficult to take the old coat off and put a new coat on. You kind of put both coats on.
Yeah, exactly.
And so it's really challenging. And this is that difference between, when my children ask me a question, they don't have a coat. They just adopt whatever dad gives them, right? And that's a bit scary as well. But it's fascinating because they're not having to replace a thought, or they've just got room for something new. And so if you don't know anything about mental health and someone says you've got a chemical imbalance,
right,
done, right? And then you take something, and obviously if you're feeling at your lowest point, and then we have regression to the mean, which means you start to naturally come up because you're in the no treatment at all. In both scenarios, placebo, no treatment at all, and psychiatric medication all show an improvement. It's a scary space to see how we tie these things together and create dependency or something. And I've gone a little bit astray there, but
no, 100%.
It's fascinating
100%.
seeing how we find it difficult to let go of old information.
And so
we hold on.
And I actually tracked this, so you can see this happening in multiple time scales. So one, in the child case, it's totally true. When it's something that's a totally testimony-based thing, like maybe how mental health works, something like that. But in the physical and natural world, kids actually do. So one of the challenges of sort of science education in primary school is actually getting them to sort of go away from the explanations that they form just from their own observation. So there are these examples of, for example, kids will think that how does day and night work, right? So the day, the sun at night, the sun is under the ground, and and then during the day it comes out of the, and the moon is in the sky at night, and then they switch, and then the moon goes under the ground and the sun comes out of the ground into the sky, right? And that is completely consistent with what it looks like, right? And so, but then when you're teaching like a 6-year-old, that's not how it works. You actually see this exact same thing where they go through, talking about the two coats, there's this period called a sort of, there's this idea that there's the naive model or the preconceived sort of model of the Earth. And then there's the sort of expert model where the Earth is, rotating and et cetera, right? So the Earth is sort of rotating on its axis, right? And then there's a synthetic model where they've combined the two, right? And so all kids go through, so even in this situation, you sort of see that like there's a time where they've integrated the two, almost no one, you can't skip that phase. Before you get to the expert understanding, you sort of have to go through this phase where you sort of integrated them. And you see this in other sort of areas of science education as well. But on a faster time scale, I did some work on COVID, where we looked at, understanding COVID as spreading on surfaces versus understanding COVID as spreading in the air, right? Because remember when COVID first came out, right? What came out? Sorry, like it's a movie. Sorry.
The trailer was really good.
Yeah.
Not so.
Yeah. Where we're just like, oh, weird things are happening overseas. Yeah, right. And then, right. So, all right. So I remember like it was all about sanitize everything, right? Spray down people, spray down, spray your groceries, right? People, this thing came out, and I remember there was a study that was like, we tested a COVID on a piece of metal, and 48 hours later, you could like detect that the virus was still there or something like that, right? And then they're like, it's and there was the idea that like, well, maybe if we just wear those, dog, collars and we can't touch our face, then we won't get it, right? And then, but actually by around July 2020, which was pretty early in the pandemic, the evidence was getting pretty clear that actually air-based transmission was important, and the surface spreading was very minimal. And that's one of the reasons why before Delta, and Delta was such a more powerful spreader, but before that, there weren't any cases in New South Wales of like documented cases of outdoor transmission, right? Yeah. All of these things like that, right? But one of the things that I tracked was that people didn't drop the surface model, right? So people added, right? So people added the idea that there was, aerosol spreading in the air, but everyone still thought about how it's like in saliva and on things, right? So remember so gyms are like, we get our weights, we're spraying everyone spray their weights down.
Do a vigorous workout where you're breathing really heavily, and just make sure you wipe down the surfaces.
Yeah, exactly. Right. And all of that stuff is all, now here was a thing where this wasn't misinformation, right? There was a brief period of time where the best scientific understanding was that's how it worked, right? It quickly changed, but everyone's minds had sort of been made up, and it was really hard to get rid of that idea, right? Mm. So what was really interesting about that was that seeing that unfold in real time, and that was related to. So, for example, I remember during the second lockdown in Sydney during the Delta. That when Delta came back, there were all these, when it came back, all these people were like, there were these people at the beach. Remember there was like a 10-kilometer radius you were allowed to go. There was like a 10-kilometer radius you were allowed to go to, and then 5 kilometers. And the people who live near Bondi were like, well, I'm going to the beach, right? They're like, and then all these people on, these newspapers would take pictures of everyone on the beach, like, look what they're doing. They're at the beach. They're like ruining this for everybody. They're causing the lockdown, and that wasn't the case at all. And I sort of told people, and a lot of the people who were concerned about the outdoor gathering were people who endorsed the surface spreading, right? So endorsing the surface spreading people were the people who were really were concerned about outdoor gathering, because if you sneezed on the grass, someone else could touch the grass or whatever, right? Sure. Anyway, sorry. So, maybe that's more on that than necessary, but you could sort of see, right. But again, that's what I mean, that the psychology of these things, right, aren't unique to misinformation, to conspiracies, to whatever else, and right? It's just how we think.
Maybe that's why the COVID space has created so much, is that because the narrative changed so much, that we became overwhelmed and we lost trust, and so at various points we probably all held a viewpoint, and then we changed the viewpoint, and then we changed it again, and we changed it so many times that we were left with, I don't know who to trust. Like even today, if someone would ask me, do masks help? It's like, I actually don't know, because I've heard compelling evidence from both sides, and I'm not a doctor, so I can't even, I haven't bothered to go to any academic, good peer-reviewed literature and try to read it and understand it. So I'm still kind of headline grabbing, which basically is the useless sort of endeavor. And I have still no idea, how does it work? Do you put one on? Do you not? I've been in the hospital recently for looking after a loved one, and it's loosely, masks are loosely used now, and that was even in a place where they were a bit more stringent, in the cardiology type of space, and they were
and in your defense, the experts. I mean, so I had at one point assumed that it's true. Everyone agrees that these masks are actually really good and they're helpful. And then I started saying, oh, actually, they're not just the like anti-mask protesters, you know, but there actually are experts who are looking at data and certain you know papers that seem to be suggesting there is an effect. They're not particularly effective. So you're totally right. So
visually, it makes sense that you know, if you cough, it's going to
Yeah.
hit the surface of
Yeah.
the right. So it has to have some effect.
Right.
But it's so fascinating that you're still debating in your brain, going, but how much of the effects? You're still in this place of unknowns, and then you kind of like, your mind just goes, you know what? I can't even think about it. You know, it's kind of like saturation, and I think in that, you know, I don't know if there's a scientific term for that, but once you get to sort of saturation, you're like, I'm not going to debate it anymore, and I'll just stick to one, you know, and usually it means yes or no, rather than that, maybe that intolerance of uncertainty of saying,
right.
I don't know. And
Yeah.
you know, I lean probably on the, I don't know. So I just won't comment.
Yeah.
But, you know, for another person, that intolerance of uncertainty might mean that I would just, you know, lean into the one that seems most reasonable, like, hey, you put it on your face, it captures something, it must therefore be good.
Yeah, no, it's true. And I've kind of defaulted to this thing where I'm like, well, I guess I'll wear a mask in situations where it's like not like inconvenient at all. Like if I'm on the train, I can just wear a mask, like no big deal, right? It's like I have no reason, you know. So I'm kind of erring on the side of caution in certain situations where there's no cost to do so, right? But once you're in a situation where you're like, well, I'm in a pub and I can't have a beer and wear a mask, right? And so then I'm like, well, I guess in this situation I'm not, right? So that's not the most like consistent.
And there might be a social cost there as well, because you want to be able to communicate openly and so on.
Right. So you kind of, you know, so that's not the most like principled scientific view of things. I'm just kind of, you know, we all just kind of develop these heuristics, right? That kind of help us navigate you know, and I mean, it's one of those things where clearly, like, if there was just this obvious evidence is if you wear a mask, you will never get sick. And if you wear a mask, you will get sick. If anything was that black and white, it'd be like, okay, I guess I'm just going to wear this all the time, right? But, you know, but right, because the evidence is not. Anyway, yeah, no, it is, it has been quite an interesting time for all of us to sort of deal with these things. And yeah, because one of the issues became, you know, I don't know, another aspect of this related to these conspiracies and these attitudes is when one aspect, if we're happy to transition again, is that sometimes these things become, you know, social group markers as well, right? So that's another, and one other factor I don't think I mentioned previously, right? Particularly in America, right, where the masking, where if you put on, you know, there was kind of like, if you're a Republican, you shouldn't wear a mask because you're like, you know, it's sort of a signal.
Oh, wow.
Yeah. So there was vaccine as well. So there was this it became very politicized, right? And people viewed, I seen these signs and I was watching these protest signs. And so early on, the protest, the sort of like the group of people who were opposed to whatever mitigation measure was out there. So early on, it was lockdowns, like before the vaccine, and then it was sort of mass, and then anti-vaccine, right? Depending on, you know, because it took a while for the vaccine to be developed, right? Early on, the focus was on like the lack of efficacy or the lack of risk, right? This isn't really a dangerous virus, right? There's no, you know, so it's just like the flu. Why are we doing all this if it's not really dangerous? Then, you know, or something like, you know, then after enough people had died, where that just wasn't, you couldn't, there was just no plausibility to that statement at all, right? Then I saw that the protesters were shifting, where I saw this one photo of a sign that said, "I'd rather die than live in fear," right? And so then the idea was, you know, I saw these like, I saw these signs outside these businesses that don't wear your mask in here, don't spread your fear. Right? So the spreading of the fear was seen as worse than spreading the virus, right?
Wow.
Because
so it was social identity based. It was like, you know, you're in our tribe or you're not. And somehow the tribe creates an identity which then says, this is how we're going to respond, which is, this doesn't exist.
Yeah.
It's not scary. It's not going to kill. And that moves from, whether it be don't wear a mask or, don't spread fear.
Yeah. And it's connected to, and also that's also a social group that really cares a lot about kind of traditional masculinity and so if you're basically a coward, right? So wearing a mask was like a sign of cowardice, right? Like you weren't willing to sort of, and so that was so they actually kind of stigmatized it, right? They kind of made doing health mitigation, they sort of made like
shamed it. Yeah.
Like they're shaming you for mitigating your risk, right? And that sort of became the strategy where at first, right? So in a way, and I have some data suggesting that was actually way more important for people's attitudes than whether or not you thought, right? How risky is it? What works? The actual thinking about what works and thinking about the risk became less important than the stigma or the shame and those types. So once you kind of create those aspects, those things kind of trump everything. I mean, I see that. So you see the same type of thing in conservative groups in America, specifically around things like climate change, as a way to sort of spread opposition to climate change mitigation policies as well. So, people say like, oh, they're going to make everyone vegetarian, right? To fight climate change. They're going to take your hamburger away from you, right? And like, you're a man, you love hamburgers, right? They sort of get into like the masculinity of meat.
Wow.
And therefore, like, and you're going to sort of lose your mass or trucks, right? Trucks.
And that is powerful because approval. Yeah. I mean, if I just think about myself as a young man, I would work really hard to try and, get my dad's approval. If I was playing sport and I, was hit, it was manly to get up and keep fighting, and I was rewarded. It was like, yeah, good. So this whole masculine thing. If I cut myself when I used to work as a mechanic, my dad taught me when you cut yourself or burn yourself, you just grab grease and you put grease into the cut, and it stops the blood. Right. And so, it's kind of like, that's good. And it's like, I believe it actually is helpful for burns. So long as they're superficial, you don't want to put, grease and affect a
severe. Yeah.
But the truth is, probably putting it underwater for 20 minutes, as they say, and,
it's probably
is it better than a grease response. But you put grease on there, you continue your job. You continue doing that. That's what a man does. And so that's really interesting, thinking about how, whether it's pseudoscience or conspiracies, you there's a current, and you go with your current, you go with your tribe. And if your tribe says, this is about, being strong, masculine, well, then all of these things are nonsense.
Right.
And we can kind of reject them. And, Rob down the road, he's 72 and he got it. And he didn't take any medical advice and he got through. As a matter of fact, it hardly affected him. Right. So therefore, done, case closed.
Right. And I'm just as healthy, right? Oh, it only hurts the weak ones. I go to the gym, you had a lot of
another one,
fitness people being against, right? A lot of the fitness people were against vaccines and stuff. They're like, I work out all the time. I eat healthy. I exercise. It's not going to hurt me. Right. Right. Yeah. So I guess, we're probably, I probably, I've gone off a bunch of different directions, right? But so to kind of, put all those things together, right? So there are these, right, as we're saying, these sort of basic cognitive things, right? Like how we generate explanations, how we evaluate explanations, how we sort of search for coherence, right, to make sense of things. And then there are these social emotional things as well, where you have, if you can't take uncertainty, you feel like your agency has been removed from you, right? Where, like, and all this sort of, it's like being in a war-torn country with low economic prospects, right, is one way to make people feel like they don't have control in their lives, right? These types of social and emotional things, lack of trust, and then also group identity, and then also these sort of group identity things that are sort of showing how these ideas are sort of at odds with the values of their group, right? All these types of things, the sort of cognitive and the social emotional, all kind of work together to sort of promote these sorts of ways of thinking.
How much does a person's popularity play into this? You know, I listen to a fair bit of Joe Rogan, and some of the stuff that comes out is fascinating and interesting, gets incredible guests on and so on. And at the same time, you see some of his leanings is, you know, absurd and odd and strange. Similarly, though, if you do listen to him for a long enough time, you do see an openness of curiosity in him trying to actually see the other perspective, you know. So you see him kind of grappling with and wrestling with, you know, ideas, trying to formulate as he's going along. So it's quite nice to observe that. But I can imagine one person, you know, watching one episode and it coming from such a strong figure, and, you know, his voice is very broad, you know, meets so many people in his popularity, that if it comes from him, is that the trust part? Is that, you know, the popularity kind of ties into the trust thing? And obviously, you know,
totally
spoke about, you know, whether it's our prime minister or, you know, Trump or anyone else, if the people believe in them, if they say, you know, I don't know, let's say in the economic world at the moment, you know, things will be okay, we're not going to go into a recession. It's like, okay, well, if he said it, he must know, you know, or if she said,
100% right. So someone like, and as you're saying, because he openly struggles, you know, openly really considers these ideas, right? He really does try to consider all these different perspectives, right? And I think, and one of the reasons because of that is that he seems really unbiased, right? So you going into that and you go, this guy's willing to listen to everybody, right? He's willing to think through all these different positions. And then he comes to these conclusions, right? And he's a kind of like avatar for the listener in that sense, because you're like, I'm an unbiased person. I'm just open to different people's perspectives, right? And you kind of go, and then you sort of go down that reasoning path, and you're totally right that, you know, and that is a way to gain, right? So people trust him. Because, you know, actually seeing his thought process is, I think, does lead to people increased trust, right? This is different than just a government person just saying, here's what we're doing. This is the truth. Go do it, right? Now, one of the things that's interesting, so we talked about all the uncertainty and how COVID jumped around and this was true, that was true. But when that is the case, there's actually evidence that sometimes being honest about the uncertainty and how this is a fluid changing thing is better for gaining trust than pretending like it's not there, right? You know, the ideal situation,
tolerance of uncertainty,
right? Yeah, and improves the intolerance of, right? Ideally, you would just have certainty and you would communicate that, right? But when it's very obvious that there isn't, so, right? Like anyone could sit there and go, we don't really know what's going on here, right? And so when that's the situation, and, you know, and some colleagues of mine at the University of Sydney have sort of written some things around like which political leaders were kind of doing the recommended communication strategy. You can look around the world and go, this person was actually really good at kind of being clear about, you know, about the level of uncertainty and also what the government action was and all these things. And these other people were kind of, you know, not really being transparent. So transparency really does increase trust, right? You need a person to appear transparent. They also need to appear competent and they need to appear benevolent, right? So sort of openness, benevolence, the perception of sort of transparency, benevolence, and competence are all quite important to, to sort of gain trust in people, right? Right. And also, you know, someone like Joe Rogan also is very, in this case, you know, he's also charismatic and he's a professional comedian, right? So, you know, so he has all these, you know, all these things, going for him, right? And sometimes the criticism of him, right? Also, of course, people only really pay attention when people aren't Joe Rogan listeners. They only ever pay attention when something sort of bad happens, right? Exactly. You know, they don't, right? So, but, you know, I think some of the controversy is kind of like, sometimes people are like, well, that's actually not a perspective we want people to sort of look at, right? So, the classic example being the kind of climate change example, where if 98% of scientists, agree that this is human-caused climate change or whatever, and then they have a debate between one person from the 2% and one person from the 98%, right? That sort of like,
Sure.
that sort of makes it seem like there's much more uncertainty than there actually is, right?
Yeah.
Now, and so sometimes but that's a different type of, sometimes the criticism where sometimes you're like, should every perspective be? Anyway, that's another issue. But yeah.
How do we buffer from this? I mean, if I think about my training, at university to be a psychologist, at least what I took away, other than obviously, the psych part, was really trying to keep an open mind that you can argue any point. That if you want to write an essay on why, CBT is the most efficacious, approach for treating depression, you can do that incredibly easily, and you can likewise do the same with any other approach, and they're all scientific, and you can argue, why one's not so powerful. So you can kind of pick something, and you can use science, against that. So for me, what I took away, and at least what I try and do in therapy as well, is when a client comes in, they come in with one rigid idea, an idea about maybe their identity, or a rigid idea about what they're able to do or not able to do, rigid ideas about how the world is. So it's kind of narrow. It's almost like, it's a narrow perspective, and therapy is really about broadening that, creating more perspectives, more variation, to open up to other explanations, and therefore maybe some other ways that someone could behave. So in many ways, I feel like I wear the skeptic's hat, and the skeptic's hat is, what else could explain this? Similarly, though, that can kind of take me down some strange paths as well, because some of the very well-established ideas, I still maintain my skeptic's hat and continue to ask, well, what else could explain this? Is this actually, where does this come from? Where is this information coming from? Why is it being distributed this way? Listen to the language. So for me, linguistics is really fascinating. So hopefully you've captured some of the question there. How can we buffer against this, or what are there certain things that we can consider about how we can be, protect ourselves a little bit from this, and while still being functional in life?
Yeah, no, 100%. So there's a few different things in there I'd like to sort of can pick up on. Well, so some of the stuff that actually seems to help is actually kind of having a therapeutic approach, right? So, so this guy, Lee McIntyre, wrote this book on how to talk to a science denier. And I was going to actually bring this up as a sort of recommended book for people, where he sort of went to flat earth conferences, and he sort of went to all these sorts of places, and he sort of engaged with people, and he sort of saw that basically, once you establish trust by showing that you actually cared about the other person's perspective, you actually cared where they were coming from, right? Then after you sort of build that relationship, then a lot of those people were very happy to look at scientific evidence for things, right? So, because if you're like the type of person, right, for example, if you're, when you're watching your, moon landing type of thing, you're like, I'm listening to experts, I'm curious, I'm interested, right? You're listening to their evidence, right? And so the idea that people who are into whatever theory are somehow against evidence isn't really true. It's just like, how do you get them to sort of engage with your argument, right? With your perspective. And so one of the things they were showing was that, you really have to start out by showing that you care about listening to them. And that's one of the problems with one sort of model where, the head of, the health minister just stands up and just tells everyone what to do, right? It's sort of a one-way communication street, right? And you actually kind of often need a dialogue, right? And And
But in a therapy session, it would always start with empathy and
right,
compassion and
exactly.
nurturing and understanding and being curious about, and how was that for you? How did it feel? What did that mean? You're trying to get into their shoes. So, a lot of those, factors are built into the way that therapy happens.
100%.
Yeah.
So, but then the issue is the scalability of that, right?
Sure,
right.
sure.
It would be much easier if a sign on at a bus stop was effective at convincing people of things, right? But if it turns out you basically need a therapist to right,
Yeah.
to do this, right?
I get how you feel. Put a mask on.
Yeah, right. So right. But that is so how so then the challenge is like how can we kind of get at that two-way street, that two-way communication street, rather than just seeming like you're barking orders at people. That seems to be, so that's one way to sort of help. So if people have people have the example of the uncle at family dinner who comes in and is, and you're like, how do I convince this, crazy old uncle of mine, right? And so one of the things is well, you got to start by really caring about his perspective and not just telling him he's wrong. Not that this is guaranteed to work, but that's sort of part of it. Another part of it is thinking about this for yourself, right? Is being willing to not just be skeptical of other things, because you should never stop being skeptical of whatever, if someone now, if you see a scientific finding in the news, it's reported by, done by researchers at Harvard in the best journal. That doesn't mean you shouldn't be skeptical of it, right? But, and so people should think critically about all of these things, but also it's not that useful to just automatically reject it either, right? So, so critical engagement can certainly lead to being that, okay, I conclude that that's actually a good thing, right? Critical engagement doesn't mean rejecting everything, right?
As scientists, we can often do exactly the same with ourselves. We go, if it's scientific, it's therefore true. Your new bias that you carry is just adopting it just because, if it's come out of this journal,
we're like, that must be good,
credible, period. So there's the trust, it's peer reviewed and and that's it. So you're not kind of observing your own biases, so you're might be skeptical with the world, but also being skeptical with your capacity to it's kind of like the confirmation bias. 80% of people think that they're a better than average driver,
right?
Seeing your own biases.
That's 100% the point I was getting to, where we can. It's really important to, looping back to that beginning thing I said about the illusion of explanatory depth and how we tend to overestimate our understanding, right? Our default bias is overestimating our own understanding of things. And so we have to look at our own uncertainty in ourselves, right? So how certain should we be in our own knowledge, right? So often skeptics are like, oh, I'm a skeptic. They say that about everyone else's stuff, but they're not skeptical about themselves,
about their own,
right? They're not skeptical
about
their own position, right? And so that's where. So I'll give you one, maybe a final finding or something like this, or is there was a study looking at people who are protesting genetically modified foods, the people who sort of get GMOs out of foods, right? And they gave people. I said, how much? They asked them, how much do you know about genes? And they go, I know a lot. Or some people said I know a lot. People say I don't know a lot. Then they also gave them a high school exam, give us a definition of a gene, some basic sort of high school science level of genetics knowledge. And the thing that predicted who was protesting GMOs in food was not knowing how to define a gene, but being really confident in their knowledge of genetics, right? So it was the combination of the highest confidence and the lowest objective knowledge that were the people who were protesting the GMOs in food, right? And so now there's actually reasons to be opposed to genetically modified organisms around like monocrops and all these sorts of there's lots of ecological reasons, but their motivation, most of the protesting motivation is like it's a toxin that's going to sort of make it's back to that naturalness bias.
Yeah.
Right. So, that case, right. So that's a case where people aren't properly interrogating themselves. Right. And that's not just them. And we all do this. Right. And so one of my sort of advice is you can't control you can't necessarily control other people's minds. We can do the best we can with our own. Right. And, and try to be skeptical, but, of course, that doesn't mean doubt yourself forever. You might check in with yourself and go, no, this is actually something I'm really confident in. Right. There's, you could certainly conclude that sometimes you really should be quite certain of your position, right? But you shouldn't, but I think a lot of people start out with whatever my kind of position is, I've reached that, because there is this thing called there's this other bias called naive realism, where we all think we're objective, but we think everyone else is full of biases. You're like, I see the world where it really is. You're a biased weirdo, right? Confirmation bias doesn't apply to me, but it applies to you, right? So, and so that's, so that's this bias that we have to sort of reckon with.
Yeah.
And it sounds like for example, in therapy, you do that type of stuff all the time.
But it is interesting, and that makes a lot of sense. And I think a beautiful place to finish up on is being able to observe your own. I'm a big EV enthusiast, and I'm part of the Elon Musk fan group, and it's going to change the world and fix everything and so on. And I can actually observe myself selecting articles to read. And if there's an article which says anything about, that EVs are terrible, I just simply don't read them, so I can observe myself collecting them. But I think the difference is, because I know that I'm doing that, I can actually also know that I don't know the whole picture. I don't know the whole story. And I can allow for there to be space which says, and I genuinely believe it, there's probably a whole lot of pollutants and all sorts of stuff. But I'm also happy to sit with that intolerance of uncertainty. I try and reduce my illusion of explanatory depth type of scenario and just kind of sit with it. But I think it's really pointed consideration that you say about trying to see it in yourself. And it's not even being critical. It's just to observe, how does my brain work? What are my heuristics? How do I take shortcuts? What do I blindly believe? It's kind of like looking at, what are my core beliefs? And if my core belief is that, batteries are good and, gasoline is terrible, you're not seeing a full picture. And in there lies the complexity. So, sure. Wow. Look, Micah, you've been unbelievably generous with your time. I thank you so much.
Thanks for having me. It's really great talking.
With your expertise. Is there anywhere else that you would like our readers, listeners, to
sure. So
follow on to continue this conversation?
Sure. So if they're interested in some, general audience sort of books that related to these types of topics. So a lot of the stuff I was talking about with the sort of metacognitive illusions so there's this book called The Knowledge Illusion by Steve Sloman and Philip Fernbach that has a really nice sort of introduction to a lot of aspects of cognitive psychology. It's a very cognitive psychology book, but it tries to explain a lot of interesting things from that cognitive psychological perspective. The book's by Lee McIntyre as well. The sort of How to Talk to a Science Denier. If that's sort of if I was mentioning, if you're interested, there's this book called Science Blind by Andrew Stolman. That one's interesting because it traces a lot about human development. So he's a developmental psychologist, and he looks at how the changes in children's understanding of the world sort of mimic like the development of scientific theories over time, where like at like 4, we often think the way like medieval theories sort of science worked. right? And so you sort of see this kind of interesting progression. Anyway, that's an interesting book. So there are probably some more books on this, but those are all books along these lines that I think are quite interesting if people are looking for more.
Fascinating topic. I think because it relates more to ourselves personally than it does the world. I think, if you can understand yourself more comprehensively, you're going to be less likely to get caught up in these and develop some characteristics where you can sit with uncertainty, because the truth is we're not going to find it, and certainly not everywhere. But there's a functional. There's some great functionality of having some skepticism, but also toward oneself as well. So, Micah, thank you so much. Appreciate your.
Thanks for having me.
Work. Appreciate you, and it
was a great conversation. Thank you.
In the future.
See you. Talk to you soon. Bye bye.
If you enjoyed this podcast, please support it by going to iTunes and putting a review. Subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.